Ladies and gentlemen, welcome back to the Insurance Summit 2021, organized by CXO Global. Now, we've got a very interesting lineup of speakers from around the world today, and let's hear more from them. Let me introduce the speakers to you today. We've got a very, very interesting panel right now. We've got Cristina Pashmi. She is from Rehability UK. She's the managing director. Then we've got Umair Khalid. He's the chief operating officer at Rehability Limited UK. And then we've got Carmelo, who's the co-founder at Rapid Health. So without further ado, putting everyone on the screen. And Christina, over to you.
Oh, thank you. Thank you very much for inviting us. We are very grateful for the opportunity to share our experiences and knowledge at such significant event. So thank you. My colleagues and I are very happy to take part. Right, briefly, I will introduce Rehability UK, and then I will hand over to Carmelo, who will be talking about our services in Pakistan. I will not be reading everything that's on the slide because that's very self-explanatory, but I'll give you a little bit of context. So Rehability UK is a UK-based health and social care company, which is also regulated in the UK and is a parent company to Hello Doctor. Rehability UK and Hello Doctor offer innovative digital health based on technology, systems, algorithms, governance, and quality assurance that is used in the UK to UK standards. We believe that this can greatly benefit the health system in Pakistan. We also bring strong values and leadership to Pakistan. So our operating model is in the interest of people who use the services. People's experience of care is vital to our work, and technology plays a big part in it. We know that the healthcare in Pakistan has gradually improved over the years. We have seen big changes in the last couple of years. However, there's still a long way to come, and digital transformation is something that the country should strive to achieve, and we are very excited to be part of it. Umair, over to you.
Yeah. So what we are trying to do in Pakistan is to implement something which is, same what others are implementing and are offering, like teleconsultations and video consultations. But I think the actual stuff that we are going to bring into Pakistan for the people of Pakistan is to actually those practices which makes a customer engage throughout the year, in fact, throughout his lifespan. We are not going to offer just teleconsultation or video consultations. We are going to offer other engagement services like Hello Fitness that we would like to customize, health sessions, fitness sessions for our customers and for their entire family. So just imagine if you are just spending less than 2 rupees a day or 3 rupees a day, and your entire family is getting all those services, all those engagement services. It is only going to increase the lifespan of the customer onto a specific product and services. We are not only going to, our focus is more on prevention as compared to protection and cure. So we'll be providing, our nutritionists will be providing, diet plans to our customers and their family. We have mental health counselors as well on our platform. And I think, where the stuff is missing and the link is missing is people usually pay for the services, but they never use it. So at an average, 4 to 5 times a year, a customer needs to interact with a doctor, a patient needs to interact with a doctor. And what will they do the entire year? So the stuff that we are going to provide are based on the studies that we are currently doing in UK and the practices which are happening there, we are going to implement in Pakistan. This will improve the health infrastructure in Pakistan significantly. And this is backed by a best-in-class, state-of-the-art AI, which Carmelo will speak about, later. I think the game changer will be that right now it is more than 80 million people, they only have basic phones, and just over 30 million people, they don't have any smartphone or any phone. And this health chaos, this is AVA machine. This is going to change Pakistan big time. This is for everyone. Insurance companies can use it, telcos can use it, people going on pharmacies can use it, people going on supermarkets can use it. Anyone in Pakistan will be able to use this machine. There are over 11,000 machines with the name of Higi right now currently working in US, and over 1 million people interact on this machine on weekly basis. Our machine is 10 times better than what is available in America right now. This machine will replace the doctors in remote areas. This machine will enable the entire digital journey of any person in Pakistan. On this particular healthcare or Eva machine, a person can come, sit, have their vitals calculated and checked, and immediately connect to a doctor if required. The backend AI, gives a patient a health score which is relative to their age group, to their, if they are in Pakistan, what is their health score as an average as compared to a Pakistani people of a similar age group, and globally as well. And people can track their own health with this machine. They can go on daily basis or weekly basis to this kiosk, this Ava machine, and can completely, keep a track of it. We need to change the dynamics. We need to change the behaviors of the people of Pakistan, and that's why we are not. We are opening up to everyone in Pakistan. And I think with this particular machine, when we link it with the insurance, so the prevention comes first and then comes insurance. And we would like to be at the middle. We would like to be the gate between the customer and other entities. So if insurance companies wants to interact with the customers, we know how to interact with them. We know how to engage with them. We know how we can get their data, how we can interact, and just like with banks, with MFIs, with Roshan Digital, what is happening, and also the telco customers. And because we are going to follow all those practices that are currently available in UK and European countries, and implementing it into Pakistan through digital means, we are going to change the dynamics of the words compensation to prevention and protection. Insurance companies, they can't become InsurTech overnight. They need health tech companies, backend AI platforms to actually, calculate the risk. So actuarial risk modeling will be completely changed in Pakistan. We are going to change the platform of actuarial risk modeling, and that will do with our AI and with our data backend, algorithms. So you don't need to calculate the actuarial risk for everyone. You only need to calculate for a specific person. That's where you become a customer-centric organization, a customer-centric product, and you can engage actually people in a better way. Rather than someone just buying an insurance or a health product for one time or a single use, we would like to be the part of that particular family or a customer throughout their lifespan. If a single guy bought buy this particular service, we would like when he gets married, his wife also, comes on board. When he is going to have kids, those comes on board as well. And rather than having insurance products or health products which are just off the shelf for everyone, we can be dynamic and we can provide customized products to those people with dynamic pricing and coverages. And I'm handing over to Carmelo to discuss about the AI, how it is going to link and how we are going to completely digitalize the entire process for people of Pakistan.
Thanks, Amir. Thanks. So I just want to start with giving everyone a few trends that's happening in healthcare to give everyone some context. So hopefully everyone's starting to see around the world that the direction of travel for healthcare globally, especially in countries which deliver the best healthcare, is all around integrating end-to-end healthcare services and very much a hybrid delivery model. And the focus is always fundamentally on a patient's whole health and not only on when they're sick or just their physical health. And what a lot of healthcare providers are seeing now in a lot of countries is that patients really want more support and personalized education and personalized healthcare on how they can stay fit and healthy. So, for example, telehealth is now fast becoming the front door for healthcare services, but it's also important to have a physical presence, such as health kiosks so that patients can have exams and diagnostics. They also want a single provider to manage all their health with the peace of mind of an insurer as backup. And within all of this, as you can see on the slide here, AI needs to play a key role here. And that's really because there's not enough doctors around the world to manage everyone's health, but also computers are able to process a lot more information rapidly. So in order to give that truly personalized preventative care, AI will really become the first point of contact to anyone who wants and needs healthcare. And what we know is that AI is getting better and better in making sure that people don't get sick. And this has an enormous benefit on healthcare systems and those in financial poverty. So what we also know is that fundamentally better healthcare and better healthcare systems lead to better economies and really advances countries on an international stage. And if you look at lots of the research papers that have taken shape now in this post-COVID world, it's obvious that good healthcare, positively impacts workforce productivity, personal spending, GDP, but it also has a very positive relationship with economic performance. So Hello Doctor really has been built for the future, for the challenges of the future, but most importantly, the challenges that everyone is only now seeing because of COVID. It really combines whole health services all under one roof. So physical health, mental health, education, it connects all the dots and really ensures that patients stay in wellness, but most importantly, reducing costs for insurers, but yet interacting with patients more. And AI within Hello Doctor is powered by the best-in-class international health standards that patients and insurers can trust. And on the next slide, what I'm going to talk about is, how all this works. So, the most important thing here is, healthcare innovations are needed to prevent and treat diseases. I mean, that is obvious, and that's becoming more apparent wherever you go around the world. But realistically, the only way to solve this is by using AI to process all this information, this data, to support doctors in making the right decisions every time, but also to support patients in understanding more about their health and when they need healthcare. And what you can see here on the right-hand side of the screen is Hello Doctor's accreditations. So what's important with innovations is they also need to be clinically safe and highly regulated. I think we can all agree on that, which is why, healthcare providers should ensure they obtain these accreditations from the regulators. A lot of regulators now are looking very much into AI, how it works. And the reason for that is, a challenge for most countries and healthcare providers is really knowing what good healthcare looks like. Okay, and a lot of organizations will talk about AI, they'll talk about algorithms, but how do you know that those algorithms are safe? How do you know that those algorithms actually are leading to better healthcare? But generally, the reason for this is also because they're unable to analyze all the data. So something important at Hello Doctor is, data is at the center of everything. So what you can see on the left-hand side is a diagram. So within this diagram, you can see there's an AI engine, and around that AI, there's lots of data points. And the thing about Hello Doctor is that all this data is read by the AI engine, and the AI engine is built around the best-in-class international standards and protocols. And the whole objective is to lead to better patient outcomes, but also most importantly, making sure that the patients get exactly what they need. And around the data side, what you're going to see now is how this is integrated into different care settings. So, a patient may need to go straight to diagnostics, or they may need to see a family doctor, or they're just trying to stay fit and healthy in their gym. The important thing around the AI and how Hello Doctor connects all these care services is that the patient is always at the center. The data is used to support the best diagnosis and decisions, but it's also there to personalize the products and services required. And then most importantly, around this, there's the safety net of the insurer. Okay, and from an insurance perspective, what Hello Doctor provides is the ability to make sure that there's the treatments or the care needed is exactly what's needed, nothing more, nothing less. So from an insurance perspective, the costs are optimal, but also most importantly, Hello Doctor offers a lot more services from an educational perspective that allow patients to understand more value from their insurance products and services. So that's, again, a very high-level overview on how the AI at Hello Doctor works. And most importantly, everything that Hello Doctor does can be backed up with evidence. So the AI that's used at Hello Doctor is explainable AI. Humans are able to understand very quickly what is happening, but also how that aligns to the best-in-class healthcare standards around the world. Over to you, Cristina.
So Hello Doctor app and Ava is actually connected together. So we've come up with a single journey. So any touch point, if the customer is calling on a UN helpline number, if they are using an app, if they are using Ava machine, so everything comes together and the backend is single, one. And this is where we are going to use, and we are using this AI engine, which is best in class and completely foolproof in terms of customer security, data security, and customer data security protection laws. And the most important thing is that when we do all these things, this has never happened before in Pakistan, that all those points comes together and create a single value chain. And I think, the quality standards, there's no other company in Pakistan which is currently operating in UK and compliant on UK health standards. So we are the only one who is right now, having care homes, providing health-related services, and are completely compliant. And Christina, can you speak about the quality assurance and the stuff that we are going to, what we are learning from Pakistan and what we are learning from UK? Christina?
You're on mute, Christina.
Of course I am. I needed that phrase to be said. It's the most said phrase of 2020. So we needed that said today. Sorry about that. So just repeating myself, thank you, Carmelo, and thank you, Umer. Just that definitely explained our model, the model that we want to introduce in Pakistan, and which is a ring fence model. It's not just providing a doctor, but it's also ring fencing and providing education and focusing on prevention, which is what we want to do. Right, my next slide is about what has changed since COVID, and everything has changed. This has already been covered in previous sessions, so I'm not going to go through every single point on this slide, but I have summarized the changes within digital health across the globe. Some countries are much further advanced than others, but there have been advances throughout. Telemedicine and telehealth have actually amplified since COVID. But going back to the insurance industry, the pandemic has hit the insurance industry pretty hard. We have felt that in the UK, not only in the health insurance market, but also business insurance. Premiums have gone up exponentially. So the customers' expectations have changed. And I'm a customer myself, and I do expect to have a good digital experience. They demand products that match their needs and are responsive service in relation to those products. There is an expectation of efficiency from the onboarding system to the claims process. In the current state of affairs brings its challenges. Cyber risk is more prevalent. The changing nature of work and consumption is also one of the market forces that needs to be taken into account. And technology platforms need to align with these forces. The disruption of the insurance gathers pace, and I think it's the insurers have to accelerate the digital transformation programs to meet these challenges head on. And I believe there are a few areas that not only in digital health, but also in InsurTech that have to be paid attention to. One of the areas is data management. So there's a lot of data already available right there, but actually, what do we do with that data? How do we manage the data that's already available? And how do we manage new sources of data with this digital transformation. And it is about, as Carmelo said, productionizing artificial intelligence and machine learning, but also incentivizing behavior changes, because all the focus is on prevention. Because on the longer term, it's more cost effective to individuals, it's more cost effective to the health system, it's more cost effective to insurers. So for example, in the UK, and I'm sure in many countries around the world, telematics insurance is incentivizing safer driving habits. And a similar model could be replicated in health insurance, which would reflect on individuals' premium. Another point that I believe that insurance companies have to take into consideration is InsurTech and health and ecosystem partnerships, because these will help to accelerate business model and product innovation. So that partnership between digital health providers, insurance providers, and telcos is key to that transformation and changes of the models available in the market. And the last thing that I believe should be paid attention to is legacy modernization. Current operations are heavily manual, fragmented, and they are not aligned with the customer journey, which is something that has been spoken throughout this conference. Right. We wanted to share with you some of the European practices that have been successfully implemented in many countries in Europe and also other countries around the world. And population health, perhaps, is the most fitting one. As you can see, the person is at the center of everything, and all the companies provide services provision that come around it. So this model is successfully adopted in Europe to support and effectively introduce innovation and best practices in health. It's an approach to improve the health of the whole population. This is about creating, as you can see, a ring there around the person. It's about creating a collective sense of responsibility across many organizations and individuals. So appropriate health ecosystems facilitate engaged management in all relevant sectors necessary for making the changes to happen in connected digital health. It's not just about providing a doctor, as I said earlier, but it's about offering that ring-fence model, and insurer providers and telcos are key parts to this. So in Hello Doctor, we want to help to bridge those gap inequalities, and we want to work in preventative health, not only reactive health. No country can survive on being reactive, as it puts a tremendous strain on health systems. And this is what we want to offer in Hello Doctor. We want to offer and provide affordable health in the click of a button, and offer the best outcomes to people with our key partners. And it's all about producing a better health ecosystem that fits in with the landscape of Pakistan. Sorry, Umer. What can we learn from the West? Apart from everything that Carmelo has already said to me, has already shared, one of the things that we can learn is governance and regulatory oversight. How do we know that the digital health we are providing is actually safe? We don't know unless we have a good governance, a good framework governance in place to audit and to identify whether we are delivering a good product or whether there are areas for improvement. This regulatory framework encourages improvement in the quality of the care and service provided throughout. We are so happy to hear about all these new startups in telehealth in Pakistan, and we genuinely hope that everyone succeeds, because that will be for the best, for the great benefit of the country. However, for success to happen, good governance and trust from the population is required. To move on to the next slide. As we said at the beginning, Rehability UK is a regulated organization in the UK. So we follow the standards set by the NHS. We follow standards set by our regulator, which is the Care Quality Commission. And that's how we operate, by following NICE guidelines. As I said, to achieve success, we will need to ensure that all these points that I've listed on this slide are actually followed and exceeded in our case. I'm not going to mention about every single point individually, but I will mention the main ones that I believe that are the most fundamental ones. The governance and quality assurance. As I explained earlier, a thorough governance and quality assurance framework in Hello Doctor is devised in accordance to a regulator in the UK. So we use the 5 domains that I have actually listed on this slide. As you can see, the safe, effective, responsive, and caring, and well-led. So these domains will help me to create a very thorough quality assurance framework that will help me to maintain that governance to a level that exceeds the expected regulatory standards. So if you're thinking about the safe domain, so on the safe domain, I'll be looking at things, for example, a medication and prescription of medications. How do we actually monitor the limit and prescribing of drugs that can potentially be misused? So that's one of the things that any digital health provider should be asking themselves. If I think about effective, I would think about the referral process. What do I have in place to refer clients to other services, and how do I actually follow that up? Another key area that we should actually be questioning. So what are those partnerships that we have with other services? Caring, thinking about the dignity and respect, but also thinking about the privacy impact and how that impact assessment is carried out during consultations. Thinking about the responsive, how conditions are treated and how not treated conditions are actually addressed in consultations. And finally, thinking about well-led. Is digital expertise in our leadership? And I think with Hello Doctor, we can say that confidently that it is. Another thing that's key is the clinical competence assessments for healthcare professionals. As digital health actually grows in momentum right now, we can't say that digital health is something that's taught at medical school. Maybe, hopefully in the future it will. But right now, I don't think it is. So how do we actually bring our doctors and GPs, nurses, or the specialist doctors to that level of competence? So it is about devising a framework that will enhance the digital competence of our professionals. And this is what we, Rehability and Hello Doctor, strive to do and strive to bring into Pakistan. So innovation is not a single methodology, and different models might be required in different contexts, and technology is the main driver of these forces. So thank you.
Anything else to add? Can't hear you, Mer.
That's pretty much it, from our side. And if there are any questions from any one of us, would love to, address it later as well.
Thank you very much for your time, Cristina, Carmelo, Omer. We do have some questions from the audience who are participants, but I believe you can take them personally during the networking session later today, because in the interest of the time, we have the next speaker waiting. Thank you very much, and
thank you.
Great work that you're doing. Ladies and gentlemen, thank you for watching. As you can see, the future of InsurTech is here and now. And then now more than ever, we need to think about collaboration. Stop thinking local, think international, think global, and something that can be accessible locally. Stay tuned for another session. We'll be joining you shortly.